The following program has been rated PG. It may contain scenes unsuitable for children under the age of 10.
Well, hello there. It's good to see you right here on Health Diary. My name is Winnie Lubembe, and today we're coming to you from the Aga Khan University. Now, did you know that about 10% of seasonal influenza infections occur in children, leading to almost over 800,000 hospitalizations? Well, I know this is a major concern for so many parents, thinking then what to do with children who are infected with influenza, or is it a case of influenza or a common cold? Well, we'll find out after this fact of the matter. Pediatric influenza, or the flu in children, is a contagious respiratory illness characterized by high fever, body aches, and cough. While most children experience mild symptoms and recover quickly, some can develop serious complications like pneumonia or require hospitalization. All right, let's get to understand more about pediatric influenza. I know for the parents, you're happy now because you will at least get information as to why your kids sometimes get sick almost all the time and you're wondering what to do and where to take them. So you want to stick around until the end of the show. We have Dr. Adil Shah, who's a consultant pediatric infectious disease specialist right here at Aga Khan University Hospital. Dr. Thank you so much for your time. And I'm just going to ask the first question most parents would ask. Why do kids get flu almost all the time?
Yeah, very good question. Yeah. So the first misconception is that it's not always a flu. Okay. Yeah, everyone thinks every cold is a flu, but when we talk about flu, we talk about influenza. And influenza, usually you'll get it once a year if you get exposed. But most of the time, what you're getting are common colds. All right. And those are usually milder. So just what we call the homers. Mm-hmm. So the ones with kids will come with every other month. You'll see them a running nose, cough, mild symptoms. But that's not as bad as what is now influenza, which tends to cause a bit more severe disease and can really make you feel sick. Even the adults, when they get influenza, they're like, oh my God, this is terrible. Yeah.
So then what is the difference in terms of either the cause or the presentation and even the severity?
Yeah, so, okay, first of all, influenza refers to the virus. So there's influenza A and influenza B viruses, which are the ones that commonly cause infections in humans. And the common presentation for influenza A and B is usually, it's like fevers, usually high fevers, cough, sore throat, and body aches. That's very common. Older children, young adults, elderly. You feel miserable, you feel like your body's aching, you feel just terrible. Yeah. And it's usually very sudden onset. So unlike a homa, which you'll feel with a bit of something scratching your throat, then maybe running nose follows a few days later, and the congestion. With influenza, it's usually very quick, like within a day or two, you get very sick. Okay. And that's why it's usually very different. And the fevers are higher, which you don't see so much with the common colds. Maybe you might have a low-grade temperature, but fevers and the body aches are very unique to influenza. And then more likely to also, cause complications. So that's why influenza we take a bit more seriously, because we know that it's more severe, especially in patients with underlying conditions. So for kids, actually it looks a bit different, especially younger kids, because they'll present with actually more like a common cold presentation, unlike the older kids or older adults. But you'll also see things like poor feeding, irritability, and sometimes they don't have the typical symptoms. They might go straight to a pneumonia, or they might get like what we call croup. Mm-hmm. So you might find that more in younger kids. And then what's more unique about younger kids is that they tend to be more severely affected, especially children under 2. They will be more sicker, and they they will go down much faster as compared to older kids or adults, and similar to elderly as well. So elderly and younger kids almost have the same kind of presentation, where it knocks them out very quickly, and then more likely to also see things like otitis media, ear infections, pneumonias, which you don't see in older population, but in those extremes of age, it can be very...
Is it something to do with like the immunity still developing and,
Exactly. So as younger kids, because the immune system is not yet developed, so a lot of it is still in the process of development. So the risk of disease or severe disease is much higher. So even any common infection, usually you'll see that they get it more easily, and they tend to have more severe symptoms, as opposed to maybe someone who's had influenza before, where your immune system sort of recognizes the virus, but because of some changes in the virus, you still get the infection, but you don't get as bad a flu, as we say.
Oh, I see. Okay.
But because younger kids have never been exposed to the virus before, or it's their first time being exposed to that type of virus, they usually get more severe disease, and that's why even we'll find more kids admitted to hospital because of influenza.
I see. What is the onset of cases maybe that you've handled of a child infected with influenza?
So usually it takes like maybe a day or two from when you're exposed. So you'll find that maybe someone in the house has it, and then within a day or two, then the child is presenting with similar symptoms now. And by the time they're presenting to you, it's maybe they've had a day of symptoms. And because within, as we said, they get very high fevers, and their feeding goes down. So you'll find that they're presenting to hospital much earlier as opposed to with other common colds.
Yeah.
And and at the time you're seeing them, the child is sick, not feeding, is almost dehydrated, has this bad cough, like a barking cough, and they look very sick. They look miserable. And and you'll see that they take by the time they're presenting to you, it's a very short period of presentation.
I see.
Yeah.
And also for the age, what is the youngest you've seen?
The youngest I've seen is a 3-month-old.
3 months?
Yeah, even at 3 months, you can get influenza. Yeah, and it's one of the things that you really worry about, because that age, they really don't have very good immunity.
Yeah.
So we usually advise parents that, if you have other kids in your house and you have a young baby, then maybe keep the young baby away from the older kids if they get sick. Or if someone else has a cold or a flu, because, as symptoms, sometimes it's hard to differentiate, but you want to keep the younger kids away, because when they get it, then it can be really bad.
Yeah.
So I've seen 3-month-old and, all the way. So, but usually the common age we see is maybe between 1 to 3 years.
Oh, okay.
Those are the ones who more commonly present.
And also you talked about type A and B, right? So is there a difference in terms of either the classical presentation or the cause for the same? And what do you see most common in kids?
Okay, so we see both A and B in kids, but B tends to be more in kids than in adults. And that just being that because more adults have been exposed to B when they were kids, so you tend to see it more in children. And B tends to cause more severe disease as well. So when kids present with influenza B, they tend to be more sicker, more hospitalizations because of influenza B, and then also a bit higher rate of mortality. Whereas A generally is what we call the annual seasonal flu epidemic, where throughout the year you find it spreading. But you'll also find B periods, and usually that happens more in children than in adults.
Yeah.
What's also interesting about A is that it's what's associated with the pandemics.
Yeah.
So if you've heard about the flu pandemics that have been going on for all these, like they happen every so often, or not, but maybe once in every 20, 30 years you find the pandemic occurring.
Yeah.
And that's because A has this property where it can suddenly change its proteins, and it looks like a new virus almost altogether.
Yeah.
So if a lot of people don't have immunity to that, and it causes this huge worldwide spread, and which is when you see like really bad disease, admissions and deaths and all that.
Yeah, like what happened with COVID. And even speaking of COVID, there's a lot of a comparison, because you see, when you talked about the classical symptoms of influenza, they sort of, quote unquote, more or less look like COVID. So a lot of people are like, so is this COVID or is it, is this influenza? So is there like a difference in terms of the presentation between the two, or is this maybe one and the same thing?
So actually, it's a good question because most respiratory illnesses almost present the same way.
Same way, yes.
Yeah, and you will use these terms like flu-like illness or influenza-like illness because they almost start the same way.
Yeah.
Even COVID was, especially before when the pandemic started, it almost started like a flu. High fevers, cough, sore throat, which is very typical for influenza. And it's hard to tell from initial presentation. So that's why with children, we advise that if you have the child is not looking well, they have high fevers and they're not feeding and they have this, they're generally not looking well, just bring them into hospital because you cannot tell, is this a common cold? Is this influenza? Is this COVID? So it's better for, a doctor to evaluate them and, then advise accordingly how to manage them.
Now, the thing is, for most parents, I mean, when you see your child, behaving like that or presenting with such symptoms, most would tend to look for ways, or home remedies to at least help. So how soon should a child be taken to the hospital?
We would generally say if the child is not feeding or if they're having any breathing problems or if they look generally very unwell, then just bring them to hospital.
Okay. All right, let's take a break. And then when we come back, we'd want to understand vaccinations, all right? And how much of a help they are, at what point should kids get vaccinated? And then we'll also look at the treatment options for influenza. But you want to stick around for that, and that is after the break. Welcome back to the show. The show is Health Diary, and today is a special conversation, I want to say, because we're focusing on pediatrics. We rarely talk about children most of the time, and we're focusing on pediatric influenza and that what that looks like in terms of presentation and what you need to do as a parent, be on the lookout for, and the first steps to take, all right? And we have Dr. Adele Shah, who's a consultant pediatric infectious diseases specialist right here at Aga Khan University Hospital, taking us through this conversation. And we're talking about symptoms, what they look like, and some of the home remedies that sometimes we do might not work, some actually work, right? But for, what are they called? Vaccinations. What do they look like? How often should kids be vaccinated? Should they be vaccinated in the first place against the influenza?
Okay, yeah, so that's important to know as a parent because vaccines have been available for influenza for a long, long time. And the efficacy, it varies because as you know about influenza, as we mentioned before, every year the virus changes a bit. So that's inherent to the virus, that it has some properties that changes. And that's why even we keep getting influenza every year because of those changes. So even the vaccine has to keep changing every year. So every year you get a new strain of vaccine being developed and then launched. So you'll find that, have you gotten this year's vaccine? Have you gotten this year's vaccine? That's why the question keeps coming up. And because of that, we know that the vaccine, if efficacy can change from year to year. So some years it might be very effective and some years it might not be as effective, but still it has some usefulness. So as a pediatrician, I do recommend that all children should still get the vaccine. Because number one, even though it might not be effective in preventing the infection, it's effective still in preventing severe disease. And as we said, kids are at high risk of severe disease, more so than even adults, especially things like pneumonia, even brain infections, encephalitis, otitis media, and generally they can even get sepsis-like syndromes. So those can, with high rate of mortality. So that's why we advise that if you have kids at home, just it's best to get them vaccinated, whether it prevents the influenza or not, but at least will prevent severe disease.
Yeah. So how early should a parent get their kids vaccinated?
So we recommend that the earliest the child can get vaccinated for influenza is at 6 months. And that's just because there's no evidence for vaccine below 6 months. So it's not being tested in children less than 6 months. So because of that reason, we actually advise also that pregnant mothers should also get the vaccine during the pregnancy because it will protect not them only, but also the baby after birth. So that the first 6 months they have that protection from mom who's been vaccinated. And then after 6 months, all babies can get a vaccine. But just that in the first 8 years of life, the first time you get the vaccine, you should get 2 doses, so 1 month apart. But after that, it's once every year. And it's recommended that you get, especially for children who are under 2, it's a strong recommendation. And then from 2 to 5, it's still recommended. And then after that, it's still useful because we know that kids spread the virus as they go to school. So they pick it up from school, they'll bring it home. So the best way to prevent those infections at home also is to vaccinate the older kids as well, because then they won't bring it home and you'll protect the family in general. Yeah.
All right. So what are some of those myths that you've had as far as vaccinations are concerned? And maybe even answer why do you feel sometimes some parents might be a little bit hesitant to get these vaccines?
Yeah. So for vaccines, we've had all sorts of things. This is propaganda. This is there's some other things inside it, and it's being used for contraception, and it causes these complications. So a lot of it is just a lot of hogwash because it's not true. It's there are rare events, and unfortunately, those rare events are what will be publicized, and you'll find them in the news and I don't want to say the media, but media likes sensation. So if you have that one rare case of someone who had maybe got bleeding disorder from a vaccine or got a seizure from a vaccine, so you'll find that now everyone is talking about that. And it happened with the polio vaccine. When the government did the polio vaccine campaign, we had those one occasional few cases of rare side effects. But because of that, everyone now focuses on the rare side effects. But what we also tell parents is, if you read the paracetamol leaflet, if you take that box, open it, look at the leaflet inside, and you'll find all sorts of side effects that are mentioned, and probably much worse than what even vaccines give. But no one thinks about it. You'll pop Panadol, like, oh, it's easy. Why am I don't, those are rare, it won't happen to me. But it's the same thing with vaccines. The ones that we know that can occur, such as you can get a mild running nose after the influenza vaccine, but that's about it. And it usually goes away after a day or 2.
Yeah, because we've had a little parents say, but the kids get sick after they get the vaccine. But some of these things are expected reactions, but not as bad as to warrant you not taking a child to get vaccinated.
Exactly. Yeah.
Okay, so then when a parent brings the child to a hospital, of course, several tests, and also the cost, informing the cost of treatment. So what exactly does that look like in terms of treatment for influenza?
So maybe we'll approach it in a 2-pronged way, because even as you're doing the tests, remember influenza tests, it's not very easy to also test for influenza. Just like COVID, you have to do a swab. Yeah, so you have to swab the throat and the nose and get a good respiratory sample to test for the virus. But those are tests that take time. So we have different types of tests, molecular test, and then there's antigen test. So like COVID, we had the molecular test, but that takes at least sometimes a day before you get your results, whereas the antigen test can come out quickly in a few hours, but it's not as sensitive. So it'll miss quite a number of cases. So usually if you're suspecting it and you have a high index of suspicion, we usually start empirically treatment for influenza. And that involves an antiviral called oseltamivir. Yeah, so oseltamivir is available for all ages above 2 months of age. So anyone who has influenza can be treated with oseltamivir. And the recommendation is to start it as soon as possible. Yeah, because its benefits are, the earlier you start, the more likely you'll get benefit. And the main thing is that the reason to start treatment is to avoid the complications.
Do we have instances where a child has like recurrent cases of flu, and what could that mean? Because remember the number we talked about, 6 for kids, 4, for 12. But if a child has like recurrent cases of flu, what exactly does that mean? And do we have such cases?
Okay, so as we said, influenza usually occurs annually. So you'll get influenza this year, you can still get it next year and the year after. It's part of how the virus functions. But if we're saying that someone is getting recurrent cases within a year, then it sort of also maybe tells you that maybe this patient's immunity is not very good. Yeah, they might have some underlying immune deficiencies. So where the immune system is just not responding the right way. So that's why maybe they look better, then after a few weeks they're getting an infection again and again and again. So that's something maybe you should, if a parent is saying that, it's best maybe to get them evaluated by a specialist, yeah? Because then that's someone who you're worried about, is the immunity functioning well? And then they're also at higher risk of other infections. So you don't want to just take that lightly. They might have something called primary immune deficiency. They might have secondary immune deficiency. You need to figure out what's causing this. And then also children such as those who have cardiac issues or asthma or are on chemotherapy for cancer, the immunity also is not very good. So they're also at a bit higher risk of not only recurrence but also prolonged influenza. So we know that influenza in a normal child, even an adult, at most it should be a week, and maybe if really like they have a cough, it can go up to 2 weeks and usually clear it. But we have found patients who have been sick for almost months with the same strain. So that just kind of shows that the immune system is not functioning in the best possible way. So they're not able to clear the virus in a normal time, and then they need to be supported. And they need to be seen by the specialist.
Yeah. Right, so then as we bring this to a close, because vaccinations help, it's important, right, for the kids to get vaccinated and get the vaccine against influenza. But on a larger scale, because these kids go to school and then they might get infected, bring it home and all those things. So on a larger scale, then what will be your advice? Either get vaccinations in schools and, just drives, as often as possible, or what will help at least to protect these kids from getting the severe form of flu and even the complications.
Okay, so the best thing is the vaccine. I mean, compared to everything else, nothing comes even close. Yeah. And I usually will tell parents, if you have a child who is at home who has underlying issues, other health related issues, or you have elderly at home, because those are at high risk, or even other people in the house who have some health issues, then get everyone in the house vaccinated, because that's the best way to protect everyone. And then on top of that, now, if you're trying to prevent these recurrent infections or children getting this, so sometimes it helps saying that, okay, if you see other kids at school who have these colds, maybe don't touch them, don't come too close to them, because as we said, kids spread it through droplets. So it's take necessary hygiene precautions. So wearing a mask is important, because that not only protects you, but protects other people as well. So when you have a cold, stay at home. Yeah, that's the number one rule. If you have a cold, don't go and expose other people. Let the symptoms reduce, then resume work, resume school, because it's the most common cause of people even missing school, missing work. Influenza is the number one cause, because it's year-round. Every year someone will get it, and then the moment you go to school, it's, as we said, it has a very high attack rate. You find the whole class is now infected. So as a parent, you should as a doctor, advise the parents that, if your child is sick, just let them stay at home. Missing 2 or 3 days because of it, you might say, oh, why are they at home? But you're also protecting the other kids. Yeah, and then teach them basic etiquette, basic hygiene. So if don't cough openly, cover your mouth, wear a mask when you have a cold, and then eat healthy as well, because as we said, immunity is key. So a lot of diet these days is very junk food oriented. So we're missing out the vegetables, we're missing the fruits, we're missing the good source of vitamins and minerals, which are key in developing immunity. So if your immunity is not, if your diet is not very good, your immunity is also not very good. And then that means you're also at high risk of picking up infections.
Yeah. Fantastic. What a way to end the show. Thank you so much, Dr. Shari. It's Adil Shah, consultant pediatric infectious disease specialist right here at Aga Khan University Hospital. Now you know better. And for the parents, now you can rest because you know what to do, okay? Well, time now for you to take a look at this health tip.
Today's health tip is on high blood pressure. Probably 40% of Kenyans above the age of 30 will have high blood pressure. And the high blood pressure is something that puts you at risk over many years. So it should be controlled. There are a variety of reasons why you'll have high blood pressure. And the most common cause is genetics. In other words, you are destined to have high blood pressure. Controlling that is important, but at least 10% of people can control their blood pressure and actually bring it into control without medication. The remaining 90% unfortunately require medication. So what are the lifestyle adjustments to help you control blood pressure? The most important thing is exercise and sleep. If you can exercise regularly and if you can sleep well, then the blood pressure will improve. The second thing is to look for something that is reversible. The most common reversible cause of high blood pressure is being overweight or obese. If you have more than 20 kilos above your normal body weight and you can lose those 20 kilos, you'll almost certainly eliminate high blood pressure.
All right, well, that marks it for today's episode on pediatric influenza. And for the parents, now you know better that not all cases of common colds is common cold. Your child could actually be infected with influenza. And the takeaway message is, if you notice that your child is not well, please take them to hospital as soon as possible. Well, my name is Winnie Lubembe, and a special thanks to the Aga Khan University for hosting us today. Until next Sunday, adios. Well, hello there. Good to see you right here on Health Diary. The 10% of seasonal influenza infections occur in children, and sometimes with an associated over 800,000 hospital visits. Not visits, sorry, one sec.